I'm about to bring you a news story, a big story, the biggest breaking story in the country. We are about to bring you what we now know to be the truth behind the science, not what you're hearing when you're watching this in the news.
A major breakthrough from Pfizer, reporting its vaccine for coronavirus in human trials appears to be more than 90% effective.
90% effective.
90% effective.
90% effective.
90% effective.
90% effective.
90% efficacy.
A 90% efficacy.
That's better than I was expecting.
It's what the world has been waiting for.
Pfizer executives are calling it one of the biggest medical breakthroughs in the past 100 years. A COVID vaccine developed in just 6 months.
You know, it's extraordinary, Wolf. It is really a big deal.
With Pfizer now on track to seek emergency FDA approval as early as this month, the 2-dose vaccine, given 3 weeks apart, is being called one of the biggest medical breakthroughs in a century.
Pfizer says it already has a stockpile of this medicine ready to go.
I think we can see light at the end of the tunnel.
Well, that's how the news organizations you watch every single day of the week reported on Pfizer's gigantic statement. They now have a COVID-19 vaccine that is 90% effective. Before I really get into this and get into what real news should actually look like, let's look at some of the headlines that have been created and what we're about to start seeing because of how mainstream media covers this. Of course, right after it, we now see Ticketmaster. How Ticketmaster plans to check your vaccine status for concerts exclusive. Now, I'm not going to get into that article or all the articles that are now arguing about will we get on planes. Here's one about planes, right? Daily Mail, no jab, no plane. Anti-vaxxers who refuse to get a coronavirus jab could be banned from traveling overseas, as well as restaurants and public transport. Boy, are they getting excited. We can't wait to really crack down on those anti-vaxxers that are just crazies when we know we've got a 90% effective vaccine now. Do you? For all of you that are joining us for the first time on the Highwire, get ready to listen to what truth sounds like. Not my opinion. We're going to actually read through the science. But before I do, let's make sure that you do realize that the day that Pfizer says we have a giant discovery in this amazing race that is 100 other drug companies trying to get to a vaccine that will be distributed to 7.5 billion people, could one day make as much as $750 billion or more if it's a cheap $100 a pop vaccine. Before we get there, let's just point out that the CEO of Pfizer, the day of, cashed out 60% of his stock and went on to make, 44 million, I think, somewhere around $4 million from that announcement. So 5 million. Good on you for making 5 million for an announcement. What is that announcement actually valued at? What does it actually mean? Does it mean they have a vaccine that is 90% effective? Let's get into what the news doesn't really tell you about. Here's what the headline said in CBS News. Pfizer says trial shows COVID vaccine is more than 90% effective. It goes on to say the pharmaceutical giant said it would be applying for emergency use authorization from the FDA as soon as final data meets safety milestones, which it expects to happen in the 3rd week of November. Pfizer did, however, strike a large-scale production and delivery deal with the U.S. government worth up to $1.95 billion to secure an initial 100 million doses of its vaccine following its approval and the option to purchase 500 million more, according to the Department of Health and Human Services. Now, that's how CBS left it, right? Oh, wow, great, 90% effective. Sure, let's just buy hundreds of millions of dollars worth of this for hundreds of millions of people in doses, and so the band plays on. But perhaps if we had real reporters and real journalists, the discussion would actually look at what Pfizer is saying and what they are not saying. Sure, the overview is 90% effective, but let's go ahead and look at the fine print, shall we? Here's what the study actually shows from Pfizer. Pfizer and BioNTech announced vaccine candidate against COVID-19 achieved success in first interim analysis from phase 3 study. Vaccine candidate, this is their own writing. Vaccine candidate was found to be more than 90% effective in preventing COVID-19 in participants without evidence of prior SARS-CoV-2 infection in the first interim efficacy analysis. Analysis evaluated 94 confirmed cases of COVID-19 in trial participants. Let me read that again. The analysis evaluated 94 people. 94 confirmed cases of COVID-19 in trial participants. The study enrolled 43,538 participants, with 42% having diverse backgrounds, and no serious safety concerns have been observed yet in our, what I think is around 2 months of this trial so far. So in 2 months, we haven't seen any really serious safety concerns like AstraZeneca, which shut down and people were getting paralyzed and things like that. Safety and additional efficacy data continue to be collected. This is very important. The study also will evaluate, it hasn't yet, remember, look at this. The study also will evaluate the potential for the vaccine candidate to provide protection against COVID-19 in those who have had prior exposure to SARS-CoV-2, as well as vaccine prevention against severe COVID-19 disease. Let me read that one more time, because I'm pretty sure by those headlines you thought this is what was established, that we have a 90% efficacy at stopping transmission and spread of the disease and catching the disease. But no, they haven't done that yet. They plan. The study also one day will evaluate the potential for the vaccine candidate to provide protection against COVID-19 in those who have had prior exposure to SARS-CoV-2, as well as vaccine prevention against severe COVID-19 disease. We've been reporting on this over and over and over again. We did a huge story about this last week, that the end points of these trials are not designed to see if they stop the actual infection. I'm not going to get into the weeds between the difference between SARS-CoV-2 and actual COVID-19, but they look at them differently. All the asymptomatic carriers have SARS-CoV-2. You only have COVID-19 if you're sick and have symptoms, but let's not get buried in this. I want to get to the most important part of this. I mean, come on, folks. We're expecting good science to be done here, right? We're trusting these people literally with our lives. And so when we look at 94 total cases out of 43,000, can we throw up this graph? This is what actually took place. Out of the 43,900 or so actual participants, or 500 participants, 94 of them, that's how big it is. Literally 94 people, that tiny little red line, their entire trial is only right now looking at that tiny little red line of 94 people and telling every news agency, which is screaming from the mountaintops, yay, we have done it, we have achieved it. We are there, Valhalla, or whatever you want to call it, Nirvana, Utopia, we are saved. Bring that back up again, please. I want to tell you, when we were trying to make this graph, we were using several different computer programs. It wouldn't allow us to sliver that small. It said, no, that's a 0. So you're saying 100% of the circle. We were fighting the program to say, no, it's just 94. We just want to see how big that line would be. Why? Because 94 out of the 43,500 or so participants is actually this. 94 equals 0.2% of the trial participants right now is all we're looking at. We only have 0.2% of them that have gotten infected so that we can get any data whatsoever. Okay, now what are they looking at? What they're comparing and they're basically saying is, out of these 94 people, forget about the 43,500 that were in the trial, out of the 94, 10% of them got the vaccine and 90% of them got the placebo or the control group, right? So what they're saying is, out of that, we now determine, now these 94, since our vaccinated group did 90% better, or had a 90% success rate, that we're now determining not only for the other 43,400, something that we haven't seen yet, we're going to determine that for you, the 7.5 billion people in the world. Now, I want to try and help you wrap your head around this because it's difficult to have numbers and really try to understand math. We've all been watching counting being discussed all over the country, right? Counting data. When do you decide? When do you call a president? When do you call a governor or a senator? How do you know when you've had enough numbers in to say, concrete, we understand this? So why don't we do this for this number with our little 90% effective COVID-19 vaccine? If we were voting, and if the vote had decided that this is what you're going to be injected with, then this is what this would look like when it came to the data on a vote for the COVID-19 vaccine. Let's bring this up, because this is how we're all looking at it, right? You have the vaccine group had 9 people that got sick. And so they're saying we know that the vaccine essentially didn't protect 9 out of the roughly 94 people. Now, I want to be clear, we made up that number 9. They are not giving us that much detail. They're saying 10%, so we're assuming somewhere around 9. Whereas the control, the other group got 85. Now, we're going, yay, it looks like our candidate is 90% effective and the control group is 10% effective. But look above. This is what we've been doing watching the counting. You don't even have 1% of the precincts reporting. You have 0.2% reporting. From 0.2%, they have just called the winner. Pfizer has won the vaccine race with a 90% efficacy rate. You and I both know, we've been watching these numbers change. You cannot have 0.2% of the reporting being done and then predict that the end result is going to be you will have 90% will still be successful using the vaccine compared to those that don't. This is insane. This is insane because you've got to pay attention to what they're talking about. They're talking about getting an emergency use authorization now from this sliver of the actual test group. They don't know anything right now. That sliver is going to decide the fate of the world. And what do I mean by that? Once they get that emergency use authorization, what we're seeing across the board is that there are discussions. Once you have an emergency use proclamation or availability to the vaccine, watch for it. It becomes an ethical question. Can we continue to have a placebo group that have not received the vaccine? Can we let them go along now that we actually have a candidate that's 90% effective? This is how this brain science is going to work. This is how they're going to manipulate it. This is how CNN is going to report it to you. This is what Sanjay Gupta is about to tell you. Because we have a vaccine that reached emergency use because of its 90% of efficacy, we've decided it would be unethical to have a placebo group receiving saline injections now that we have a product that can protect them. And then they go and inject your entire placebo group, thereby ending any future discussions about the safety of this vaccine. Now, when you watch all these headlines screaming 90% effective, I want to be perfectly clear. We don't even know where these people live. We don't know anything. When you talk about science being done correctly, you've got to look at all the confounding issues. Where do they live? Are they in a highly infectious rate? Were the people that got the placebo in a higher infection rate like Brazil or Africa? Or were they somewhere else like Sweden? And just to be clear, when we list out this group, when they say our test group, it's not just in America. It's not just in England. Here is the list. It goes on and on. You've got United States, again, Germany, Brazil, Argentina, South Africa. This thing is all over the world. I think it's 154 different countries, eating different food in different weather patterns. We don't know if these people went and got a flu shot or didn't get a flu shot. We have no idea how these people are living. They literally, as far as we can tell, have grabbed the first 94 people from satellites all together in 154 different countries, and we're determining, don't care where they come from, what their lifestyle is, we're going to compare them to each other and say we have a 90% efficacy rate on this. People, you cannot make this stuff up, and you've really got to wake up about what is taking place here. And so I want to point out that we're now watching in England that they are rushing into delivering this vaccine. In America, we have a president about to do it. Here's what's happening in England. GP services could be cut back for months as armies help surgeries roll out surgeries roll out 1.2 million COVID vaccine doses a week starting on December 1st. Literally just a couple of weeks from now, they are about to start rolling out what looks like this vaccine has got no long-term safety understanding. We have no idea what the lifestyles of the people, this tiny 0.2% sliver of a trial, absolutely unreal.
If you like that clip, then be sure to check out our live broadcast of the Highwire every Thursday morning at 11 a.m. Pacific Time. You can watch it on Facebook, iTunes, and Twitter. We'll see you there.